Hello and welcome to the Canadian Public Health Association's Infectious Disease and Climate Change webinar series. This webinar series will be exploring current and emerging infectious disease and climate change topics to share knowledge and research and best practices. I'm Lydia Ma, manager of the National Collaborating Centre for Environmental Health, the 6th National Collaborating Centres for Public Health program funded by the Public Health Agency of Canada. To learn more about each of our NCCs, please visit the website nccph.ca where you can be redirected. It's a pleasure to be your webinar moderator today, and I begin by acknowledging that while you, our audiences, are online, I'm on the traditional, ancestral, and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations. Shortly, our speakers will give their respective land acknowledgements. We all are very grateful for this privilege. Today's webinar is entitled Public and Expert Perceptions of Climate Change and Health, Focus on Infectious Disease. British Columbia remains in a state of emergency as a result of an immense flooding catastrophe that came upon us within 5 months of a historical heat dome, devastating wildfires, destruction of an entire town named Lytton, BC, which is one of the oldest continuously settled communities in North America. An atmospheric river, the first of more to come, according to Environment Canada's forecast, caused devastating losses both in lives, humans and animals, extensive damages to infrastructure and properties, massive disruption and evacuations of people in Merritt, a city in the Nicola Valley of the South Central Interior British Columbia. The irony and the realness and timing of what happened in British Columbia is not lost, with the United Nations Climate Change Conference in Glasgow, COP26, adjourning on November 12th, the day right before the current large-scale disaster. Our climate crisis is more real than ever. We thank the Canadian Public Health Association for facilitating this essential conversation. Our presentations and conversations to follow are irrefutably on point and in time. Please note that all attendees are muted. As questions come up for you, please type them in the Q&A box. We have turned on the upvote feature, so if you see similar questions to yours already posed, you can do so by upvoting, and we will take note of the most voted questions to prioritize them. I will pose your questions on your behalf and our presenters will respond to them. So please be enthusiastic to participate. We appreciate your input that can enhance our knowledge exchange. If you experience any technical issues, please flag them also in the Q&A. And if others also experience the same issue, we can address it live. This session is recorded and will be made available on CPHA's YouTube channel a few days after the end of this presentation. And also note that presentations will also be shared in the webinar follow-up email. Your feedback will help us improve this programming. So please do take 5 minutes to fill out the survey that pops open automatically upon adjournment and the closing of your browser window. So now I would like to introduce our speakers for today's webinar. Laura Cameron is a research associate with the Prairie Climate Centre, living and working on Treaty 1 territory in Winnipeg, with an MA in Indigenous Governance from the University of Winnipeg and a BSc in Biology from McGill University. Her research interests are transdisciplinary with a focus on climate change communications and public engagement, Indigenous knowledge on climate change, and the health impacts of climate change. Mohammed Alam is a research associate at the Prairie Climate Centre. His deep regard to creating more livable and sustainable communities has led him to be in climate research. Alam has a wide breadth of knowledge and expertise in quantitative analysis. He has a bachelor's degree in urban and regional planning from the Bangladesh University of Engineering and Technology and a master planning from the Queen's University at Kingston, Ontario. Jillian Pritchard, your usual moderator of CPHA Infectious Disease Climate Change Forum, is a speaker today, and she is a project officer with the Canadian Public Health Association. She has a BSc in Health Promotion from Dalhousie University and a Master of Public Health from Queen's University. Her work focuses on increasing the knowledge and capacity of, as well as collaborations among professionals and providers across Canada, so they can be informed and educate the communities and respond to the increasing demands posed by climate change and infectious diseases. Now I turn over the podium to our first speaker, Alam.
Thank you very much, Lydia. We're going to show the slides in a minute. Good afternoon, everyone. This is Mohammed Alam, and me and my colleague Laura Cameron. We're going to present a topic on public perception on climate change and health in Canada. And the result findings is going to be from a national survey. We recognize that there is a lack of in knowledge or in communication, the risk of climate change and how it's impacting the health in especially the Canadians among all laypersons. So through this presentation, we try to show to our audience that how climate change and health are highly linked, and that's what we part of our objective is to. Next slide, please. Before I go further in detail, I also like to acknowledge the University of Winnipeg and the Prairie Climate Centre that we work on is located on original lands of Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples, and on the homeland of the Métis Nations. As you just all we know that we had this summit in Glasgow around climate change, and if you look at this the COP summit that concluded recently, all actually highlighted the climate change and its impact on our health. And recent reports by Lancet also recognize that they even put a code red for our health future. So that, and there is a lot of disconnection that how climate change could impact our health. But there is a lot of studies and scientific evidence are becoming more common in recent years, and they're all highlighting that climate change having a huge impact on our health, not only the physical one, but also to the mental one. Okay, the next slide. And you can see this mainstream media is also highlighting this and how it's claiming even lives. And we see in the past summer in British Columbia, these heat waves, and now right now it's having these floods. These all can be attributed to climate change. So we can see clearly the link between the climate change and how it's impacting our communities across Canada. And that's why we're here to make more impact on our people, that these incidents that are happening can be avoided or can be limited. We can mitigate it with the correct knowledge. And Prairie Climate Centre that we work at, we try to educate people on that. We try to educate people based on real science. We try to communicate people this impact and risk of climate change through the visual media like the documentary, video, maps, which people easily can connect themselves. And we try to put this evidence through a storytelling way so that they can connect themselves how this climate change impacting them. It's because oftentimes people don't see the impacts are happening on them, but they cannot connect how climate change is actually resulting those impact. And we try to do that in our Prairie, excuse me, in our Prairie Climate Centre. So this climateatlas.ca, if you can go and see, we have these content-based topics, and if you just click on that, you could see there are models with 30-degree plus temperature. There are models that talks about the infectious diseases due to the emergence of infectious diseases, the re-emerge of the infectious diseases that we thought once gone forever, but it's coming back. And these are all informations we try to put for you in our climate atlas through our Prairie Climate Centre. So it's just the impacts having in our all community. There are 2,000 cities and towns and regions we covered in our climateatlas.ca. And those are with evidence, and we often engage ourselves with the experts from Public Health Agency of Canada, Health Canada, and many other provincial and federal governments, and many other NGOs and private organization communities. We also work with them. Most of the all the studies are actually peer-reviewed and with all evidence in there. So it's a storytelling in a way that we can communicate with them the risk perception of climate change, the mitigation, and the adaptation afterwards, how we can actually combat this climate change issue, because it's a global issue right now, but the issue can also give you the opportunity to act on it, and then how innovative we could be to combat this issue. And that's why we often engage, we often collaborate with our experts and make it more like science-based one at our Prairie Climate Centre. And from Health Canada and many other organizations, they have these indicators, the health indicators. We also incorporated in our studies. It's just one click away. If you go on climateatlas.ca, you could see these indicators of our health, from air quality to infectious diseases. Just a click away, and you could learn a lot how we are able to communicate those risk of climate change to people. And in the next slides, we'll talk about the climate, the infectious diseases, because there is an inherent link. When temperature goes up, these mosquito-borne diseases, which are predominantly common in the warm climates, such as in the tropics, and this is also becoming more common in Canada. Especially, we're already familiar with these mosquito-borne diseases in our southern Canada, but it is also shifting to the northern Canada as the temperature is rising due to the climate change. So this is a real opportunity for us that how to act on it, and then we can limit the impacts when people are aware of that. Especially, some of the impacts are more intense in our northern communities, in the indigenous communities, the vulnerable communities, as you learn. And just it's evident. And at the same time, when temperature goes up, it can impact the water system. Lake Winnipeg, as you know, that the spread of algal bloom is partly attributable to the rising temperature, the climate change, and government and many other organizations spend millions of dollars to combat it. But if we are able to engage ahead of time, and that's when we can combat this issue. So waterborne diseases, it's not only like spread of algal bloom that's limiting us enjoying the summer hot days in our lakes and in our other water bodies, but also it's impacting the ecosystem, which later on obviously going to impact our health system as well. And of course, the tick and the Lyme diseases. We did a lot of studies at Prairie Climate Centre. My colleague Laura would be able to tell you more on that as well. That when temperature goes up, this could come back again, or this is also happening as a new, the Lyme diseases in many parts of Canada, especially the eastern part and the central part of Canada are already the victim of these the Lyme diseases in Canada as well. Okay. Now I'll ask my colleague Laura to take this from this point on.
Thanks, Alam. So yeah, as Alam said, we've created all these communication materials on the Climate Atlas, specifically in the health topic of the Climate Atlas. And what we're interested in doing as climate communications people at the Prairie Climate Centre is also testing these materials and getting feedback on them in order to better refine our process and create better evidence-based communications materials. So we first did this in a small sort of case study in southern Manitoba using the Lyme disease materials that Alam mentioned, video, article, and map. And we tested these in 6 focus groups in southern Manitoba, looking at where we divided the populations into high and low climate change concern groups. And we tested both their perceptions of these issues as well as their responses to the materials. And so we won't go into detail on these results right now because we want to move to the survey that we did, but we'll just mention that these results are published in 2 papers if you are interested in learning more. The first focuses on public perceptions of Lyme disease and climate change in southern Manitoba as this case study area. And the second focuses more on the specific results of testing these evidence-based communication materials, videos, text, and maps on these focus groups in this region. And so after conducting that focus group study, we wanted to sort of broaden the scope and look more nationally at Canadians' understanding of the health impacts of climate change to really get a better sort of baseline of where we're at in terms of knowledge of climate change health impacts. So specifically, we were looking at the extent to which Canadians understand the link between climate change and health, and also to evaluate Canadians' level of concern about specific health impacts of climate change. And then again, we did test some materials and to see how people respond to different framings of climate change information, such as the health framing versus biophysical. But for the sake of time in today's presentation, we're just going to focus on these two first research questions. And the results of this survey are currently under review for publication, and some preprints should be available soon if you are interested in more detail. So we conducted a survey of just over 3,000 Canadians in December of 2020, just over a year ago, or just less than a year ago, rather. We partnered with Nanos Research to draw the sample from their probability panel, and many of the questions were on an 11-point scale from 0 to 10, which you'll see in the figures of our results shortly. And the data that we're going to share today was weighted by demographic characteristics of age, gender, and province in order to better reflect the national population. And so we felt it was really important to do a survey at this time, given being in the midst of the pandemic and, as Lydia mentioned, the ongoing sort of onslaught of climate catastrophes in Canada this year so far that are impacting health, and really just being in a critical moment for sort of reestablishing this baseline of public perceptions of health and climate change. So we measured a variety of variables, including relative concern about various climate impacts, as well as concern about specific health impacts of climate change, this awareness of the link between health and climate change, people's affective assessment of the health impacts, so whether they think that climate change is good or bad for health, and in response to an open-ended question, people's unprompted knowledge of the health impacts of climate change. So initially, we did have sort of a set of baseline questions in the survey that looked at people's climate opinions. And following some methodology of the Six Americas survey in the US, we did an analysis, a latent class analysis, to identify different climate opinion groups within the Canadian audience here in our survey. And so we identified these three groups, which we've named here as the disengaged, being about just less than 20% of the population, the concerned at about 30%, and the alarmed, being almost half of the population. And so the alarmed are demographically characterized as being more politically moderate and left-wing, with having higher levels of formal education. And those are people who are more alarmed about climate change. The concerned being more politically moderate and right-wing, and the disengaged being more politically right-wing and practicing of faith, with the largest percentage of high-income individuals. So we use these three climate opinion groups throughout our results to sort of better understand the nuances of knowledge and perceptions of health and climate change among different climate concern groups. So first, looking at the perceptions of climate change as good or bad for health, we see that the majority of Canadians perceive climate change as being bad for health. We see across the entire sample, 61% of people responded 7 or above, so being bad or very bad for human health. When we break that down across our climate concern groups, as you see in this figure, here on the left, we see the alarmed, the concerned, and the disengaged. And we see that among the alarmed, there's a much higher proportion of people that perceive climate change as being bad or very bad for human health at around 89%, whereas with the concerned, that's less so. And with the disengaged, it's only about 6% of people who are perceiving climate change to be bad or very bad for human health, and a much larger portion of people perceiving climate change to have neutral or positive benefits for health. And another interesting result was across demographics. We found that more women perceived climate change as bad or very bad for health, around 69%, as compared to men, which were about 53%. In response to an open-ended question, so we wanted to look at how much do people know about how climate change impacts health without being given any information. We found that over half of the population could correctly name one or more health impact. About 58% of people correctly answered that question. And so we coded those open-ended answers and we found 21 health impacts. And so this figure here shows the top 10 impacts of top 10 most common impacts that were named in response to this open-ended question, with the number one being impacts related to food security, and then air quality, temperature-related impacts, infectious diseases, extreme events, and so on. We also see in this figure that the climate opinion groups represented here in purple, blue, and yellow, we see the largest proportion of answers given by the alarmed. They're also the largest group in the sample, so to some degree that makes sense. And a very small number of responses given by the disengaged group. When we look at the connection between climate change and health, so we were testing how often have people thought about this connection between climate change and health before taking this survey. We find that across the entire sample, about 53% of people say that they have thought about it quite often, so 7 or above out of 10 on this scale. When we look across climate change concern groups here, with the alarmed, the concerned, and the disengaged, again, we see a large discrepancy between the alarmed, who have the majority of which have thought about this connection between climate change and health often, and the disengaged being a much smaller proportion that have thought about this very often. And geographically, we find the highest awareness of this link between climate change and health in Quebec at 58%, and British Columbia at 56% of people saying they've thought about it often, and the lowest awareness in Saskatchewan, Alberta, and Newfoundland and Labrador at around 40%. And so when we dig into this a bit more, looking at people's concern about the health impacts of climate change as compared to other impacts of climate change related to national security, economics, and biophysical impacts, for instance, we see that overall in the whole sample, there is a pretty moderate level of concern about the health impacts of climate change, with about 54% of people saying they have high or very high concern in this area. But when we break that down again among the alarmed, the concerned, and the disengaged, as seen in this figure, we see that the alarmed have a relatively high concern about the health impacts of climate change as compared to national security or economic impacts, for instance. Whereas the concerned, that's more even across the different categories here. And among the disengaged, we see a very low relative concern, about 6% of people having high or very high concern about the health impacts of climate change, being lower than these other categories of national security and economic impacts. When we look specifically within the health area, and we tested a variety of health impacts of climate change that are grouped into these 5 categories, we find that water and food related impacts have the highest level of concern, followed by air quality and infectious diseases, although there's not a huge spread here within the sample. And another interesting note here is that we find demographically people with the lowest income consistently have, or low income people consistently have the highest concern across health impacts of climate change compared to those with higher income who consistently have a lower level of concern. And again, we broke this down across climate concern groups and find some interesting differences there. So just to summarize, we found that the majority of Canadians perceive climate change as being bad for human health, which suggests from a communication standpoint that communicating about the health impacts of climate change may find some resonance across the Canadian population. We find that unprompted knowledge of climate change health impacts is high among the alarmed, but remains low among the other half of the population, which suggests that really more targeted education on these health impacts of climate change is needed to reach those who are less engaged and concerned. We find a high awareness and concern about the connection between climate change and health among the alarmed, but less so among the other groups. And so this raises some questions about the success and efficacy of using a health framing in climate communications, which is often thought to perhaps be a useful bridge in terms of reaching people across the political divide who are more skeptical perhaps of climate change or less engaged. And our results here suggest that we really need to, I think, interrogate that a bit more to see how useful that framing is. And finally, we find varying concern about specific health impacts with the highest concern for future generations and food and water security. And this just provides useful information for communications that are wanting to either target specific impacts of high or low concern or reach specific audiences on these impacts. And so overall, we hope that this survey information can help to provide a good baseline at this point in time when we think that with the ongoing pandemic and climate emergency, there is like strong potential to increase public understanding of the relationship between public health and climate change. And we look forward to any questions that you might have. So I will stop sharing my screen now and I will pass it to Julian.
That's great. Thank you so much, Lauren. I'll just share my slides now. Perfect. Okay, thank you so much. That's so interesting to hear what you've been doing and what the public opinions are on climate change and health in Canada. So just to introduce myself, although I'm sure I've seen many of your names come up or joining us on our past infectious disease and climate change webinar series. But I'm Jillian Pritchard. I'm usually a moderator for this series, but today I'll be presenting some of the work that we do at CPHA. My pronouns are she and her, and I'm a project officer with the Canadian Public Health Association working on our infectious disease and climate change project. I'm joining this webinar today from the ancestral and unceded territory of the Algonquin and Anishinaabe people. They have been the guardians of this land for millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis people and their governments in realizing meaningful truth and reconciliation. I'm really excited to join you all today to share the findings of CPHA's Infectious Disease and Climate Change in Canada Key Informant Interview Report. So our project is funded through the Public Health Agency of Canada, their Infectious Disease and Climate Change Fund. Our project is a 3-year project which aims to build the knowledge and capacity of professionals and providers across Canada so they can inform and educate their communities and respond to the increasing demands posed by climate change and infectious diseases. At the start of our 3-year project, we really wanted to reach out to experts in the field to scope the project's work and identify key issues to inform the rest of our work moving forward. The focus of these interviews was understanding climate-sensitive infectious diseases in Canada. So these are diseases like Lyme disease, West Nile virus, hantavirus, and E. coli. And they're really affected by climate change because climate change is shifting the size and location of Canada's animal population. So as our climate changes, animals are able to live in places that they were previously had unsuitable habitat. And when animals move, we know that they often bring bacteria, parasites, and viruses with them. And these animals can spread infectious diseases to humans through their bites or their waste contaminating food and water. So for example, mosquitoes can carry viruses and parasites like West Nile virus and malaria that they can spread to humans when they bite them. And we know that small changes in climate impact where and how people get these infectious diseases. So we wanted to reach out to experts in Canada to really understand what is going on in our country. So we conducted an initial review of stakeholders, people working in the fields of infectious disease and climate change. We reached out to some of them and invited them to participate. And then at the end of the interviews, we did a snowball sampling method where we asked them if they had any colleagues that they thought would be a good fit for participating in the interviews as well. So through all this, we identified 81 potential participants, and we invited 30 for the conversation. So we really wanted to balance getting a representative sample of people from all of the provinces and territories. And then we also wanted to make sure we were getting a very representative sample of different organizations. So we reached out to organizations like climate action organizations, government agencies, Indigenous organizations, public health, universities, and professional organizations as well. In total, we did 16 interviews from 15 different stakeholder organizations. And following those interviews, we reviewed and analyzed the data for emergent themes, which I'll outline in this report. So one of the three key issues outlined here are the spread of infectious diseases in Canada. So the first one was that climate change is impacting the spread of infectious disease that's already endemic in Canada. So we're seeing things like longer summers, changes in rainfall, more extreme weather affecting vectors like mosquitoes and ticks in Canada, as well as food and waterborne pathogens. So a great example of this is Lyme disease that we're seeing that it's already endemic to Canada, but it's spreading to regions of the country that we didn't see it before. And one of our key informants noted that we're seeing a migration of Lyme disease at about 50 kilometers a year. So it's traveling quite rapidly into communities that wouldn't necessarily in the past have had to look out for ticks and know how to prevent Lyme disease. Also, climate change is driving zoonotic diseases northward into Canada from the continental United States. So key informants brought up new tick-borne diseases. So they said they're seeing more cases of human granulocytic anaplasmosis, and they expect to see babesiosis to spread to Canada in the future. And one of the great quotes we had from the key informants really summarized as well, saying that all we have to do is look south of the border, and there are plenty of vectors and diseases in the US that could end up here quite quickly. And then thirdly, climate change is contributing to the introduction of diseases from countries other than the US. So this is a bit more complex. It was described as having the vectors that may enter Canada from the US. So for example, exotic mosquitoes that we wouldn't normally see in Canada can migrate up, but having the diseases themselves originate from elsewhere. So with travel and migration, maybe seeing things like malaria, yellow fever, Zika, and dengue that we wouldn't in the past have had mosquitoes in Canada that could support the transmission of those. But in the future, that is a possibility. And if anybody wants to learn more about this, our last infectious disease and climate change webinar was with the Windsor-Essex County Public Health Unit. And so they're kind of one of the most southern parts of Canada, and they talked about exotic mosquito species in the region. Really encourage any of you to look it up. It's a great webinar. One of the other key issues we're seeing is that the secondary health effects of climate change also impact infectious disease spread. So we're seeing things more like frequent natural disasters, including floods, wildfires, and extreme weather events. And when these happen, they displace populations, and which makes people more vulnerable to infectious diseases due to crowded living conditions, trouble accessing medications, and timely healthcare. So these would be infectious diseases like tuberculosis, COVID, and sexually transmitted and bloodborne infections. Our key informants noted that climate-sensitive infectious diseases have a marginal research and funding profile, so they only receive a very small portion of the overall amount of funding for research and healthcare that's available in our country, and they aren't widely recognized as a priority public health issue among the wide variety that are out there. They also noted that Canadians will experience the health-related impacts of climate change well into the future. So we know this isn't going to stop anytime soon, that climate change will continue to affect all life on this planet, both human and animals, for generations. Therefore, it's going to have effects on infectious disease incidence and spread that will be long lasting. And that's something that we really need to prepare for. And finally, they noted that we must address the health equity dimensions of climate change and infectious diseases. So the key informants really stressed that we need to ground all of our efforts in health equity to ensure that we don't leave vulnerable populations behind. I think this is something we've been seeing with the COVID pandemic, that we really need to continue on into our climate change work. This is one of my favorite quotes of the key informant interviews, saying the gaps are huge because they are unfathomable. I think this really summarizes the theme of all of the challenges and gaps that the key informants brought up to us, that we really don't have enough information to fully understand yet the impacts of climate change on infectious disease. So this really feeds into, there's a real inherent complexity and uncertainty around this. So there's a lack of understanding of how ecosystems respond to change in ways that impact the health of both animals and humans. It's very complex, and which makes it difficult for public health and policy to anticipate and mobilize and adapt to coming changes when there's so much uncertainty about what will happen and what we can do to prevent adverse health outcomes. They also noted there's difficulties with monitoring and surveillance. So when you think about the links between climate change and human health, there's many things that need to be surveilled. So looking at changes in weather patterns, the state of ecosystems, where vectors like ticks and mosquitoes are living and spreading, and the incidence of infectious diseases as well. So pulling all of that data together can be quite difficult. They noted, surveillance can be quite siloed. And so to be able to merge all of those data sets to do predictive modeling and be able to infer the health impacts can be quite difficult and needs to be improved upon. Also, they noted there's a lack of recognition and prioritization around climate change and infectious disease. So the health effects of climate change are less evident. And so more pressing issues like COVID are sidelining our focus to be able to prepare for these changes that we're going to be continuing to see into the future. Also, they noted there's real challenges in multi-sectoral work. So this isn't something that just public health or just healthcare can deal with alone. They're really complex issues that require collaborative solutions. But they noted when other sectors often develop plans to address climate change, it often doesn't go so far as to address human health, and certainly not the infectious disease impacts, certainly. So there's a real need to bring those perspectives into conversations beyond public health. They also noted that we have an outdated built environment that's not necessarily ready to deal with climate change. So, for example, one thing that was brought up a lot was building codes and how they're very slow to change. And they don't adequately account for how the urban built environment may be contributing to the spread of infectious diseases. And then perceptions and attitudes was also brought up in Canada. So key informants noted that there's, in general, a failure to see how human health and ecological health are very connected. But this is so important with climate sensitive infectious diseases. And there can also sometimes be a skewed risk perception. So people seeing some diseases as more of risk to their health than they actually are. So for example, number of Lyme disease cases overall in Canada is smaller than the number of cases of like E. coli or food and waterborne illness. But I think there's sometimes more of a fear of ticks. And so, yeah, that risk perception can be skewed. Sorry. And they also brought up the climate denial and hesitancy still exists in Canada. And this is something that we need to address. But with all of that, the gaps, they also noted that there are some successes and opportunities that we have in Canada and that we can continue to build on. So they noted that planetary health perspectives are being integrated into some programs and policies. So they brought up examples like Indigenous governance models, planetary health models, and specifically the Canadian Medical Association and the Canadian Federation of Nurses Unions recently brought these into some of their strategic plans and discussion papers that they've published recently. Also, knowledge translation efforts that are going on were brought up as good examples. So for example, our national collaborating centers that like the environmental health one that our moderator Lydia Ma manages are doing a great job of translating the research into practice into something that people is easily digestible and understandable. And they also brought up continuing education for health professionals. So for example, at Queen's University, they do continuing education every year for medical professionals to understand how to diagnose and treat Lyme disease, because this is an area where they're seeing more and more cases. And so this way they're building that capacity in their community to deal with it. There's also some promising collaborative work between health and the environment. So key informants put up a number of examples, including the coal phase out in Ontario, where health and environment worked together on a common goal to phase out coal in Ontario and did it successfully. And also the Canadian Arctic One Health Network, which has been working together in our north to monitor diseases, human health and animals. Some more successes and opportunities brought up was the available funding envelope. So the Public Health Agency of Canada, as I noted, have an infectious disease and climate change fund. And many of our key informants brought this up as being very important, is that when there's funding, that means that researchers can actually take on some of these issues that we need to learn more about. And so having funding like this really helps bring that focus in Canada. Also using mapping as a communications tool, at least for our professionals and providers, they found having that visual information really important in understanding disease. So I think especially with climate sensitive infectious diseases, because they are spreading across Canada and changing, being able to see that visually was very important. So they brought up examples like the Prairie Climate Centre's Climate Atlas of Canada, which Laura and Alam spoke about earlier, and as well having resources like etick.ca where people upload pictures of their ticks, and then you can see that visually represented on a map of where ticks are being found in Canada. There's also a lot of great federal assessment work going on. For example, the Health Adapt program, which is helping the health sector prepare for climate change. And there should also be a report coming out in the near future driven by Health Canada called The Health of Canadians in a Changing Climate, Advancing Knowledge for Action. And that's a great snapshot of where we are with climate change and health for our country. And we also spoke with some planners, and they brought up that there has been a new climate emphasis in planning. So this goes back to that built environment piece. But they brought up that Infrastructure Canada has recently introduced a requirement to incorporate a climate lens into all of their requests for proposals. And so that really makes it, it's one way of kind of forcing organizations to start looking at climate and our built environment moving forward. And in summary, what we found from speaking with all of these experts and understanding the different perspectives is that climate change and infectious disease are interconnected in ways that we still don't fully grasp. We need to do more work to understand that, but yet there's real urgency in recognizing and building capacity around the human health consequences of climate change, including the continued spread of climate sensitive infectious diseases. So we can't wait to understand everything before we start addressing this. There has been recent federal leadership and funding on climate and health, and the climate, which is a positive development, and collaborative academic research linking ecological and human health is also promising. And finally, as we continue building capacity to better respond to the impacts of climate change on human health and infectious diseases, we need to work collaboratively and keep health equity at the forefront of everything we do. This was a good summary of our report and what we have, but there's a lot more detail in it. I feel like I barely scraped the surface. It was a really fulsome conversations with these experts. So if you'd like to read more of the report, it's on the Canadian Public Health Association's website at cpha.ca, where you can read that. And we have it both available in English and French. And even if you just want to look to read the summary, I think it's a very interesting snapshot of where we are in Canada at the moment with regards to climate change and infectious disease. So with that, I'll hand it back over to our moderator.
Okay, that's wonderful. Thank you very much. I'm just going to share my screen once again. Yeah, so we just heard from our three speakers, very interesting information and relevant for the present topic. We certainly have heard from the Prairie Climate Centre colleagues of a national survey with revelations that are not completely surprising, but it is great to have it quantified in the manner that it is. And also, thank you so much to Jillian for CPHA's work and the great synthesis of getting that representation of key informants, gaps, opportunities, challenges before us. So we do have three questions in the Q&A, and I invite participants to continue to type in your questions in there. But in the meantime, I will pose these questions to our speakers. The first one related to the research question number 3 that was on Laura's presentation. That was about testing Canadians responding to different framings of climate change information, example, biophysical versus health framings. So I wonder if Laura and our alum could respond to that question.
Yeah,
what you meant.
Yeah. So what we meant by that, so we were testing sort of biophysical, just meaning kind of like increase in heat waves or increase in forest fires, or talking about sort of the direct climate impacts. And then a health framing, on the other hand, talking about increase in heat-related illness, such as heat stroke, or increase in sort of respiratory issues coming from the air quality impacts of wildfires. So that was sort of the comparison that we were looking at in those different framings and testing different people's responses to those different impacts. I hope that answers the question.
Okay, and also related to your survey, the relevance of faith to the study. How did you arrive at them?
Yeah, so just in terms of the first part of the question, I guess, how do we arrive at the survey questions? We did review similar surveys on climate change and health impacts from around the world. They're particularly the group in the US at the Yale Climate Change Communications School, and other researchers in the US have done a significant number of surveys on climate change, climate opinions, and climate and health. So we looked to those examples a lot, and we did borrow some questions from previous surveys there. And in terms of the relevance of faith, we just had sort of a bank of demographic questions that we included, including how people practice their faith, as well as sort of their income and their size of their community, their ethnicity, all sorts of questions, just to better characterize the sample and better be able to understand who different sections of our audiences are, in order to get clarity and help us better understand these perceptions of climate change and health in relation to different demographics, so that we can better sort of reach those audiences.
Great, thank you. Maybe I'll pose this question to Alan while we're still on the Prairie Climate Centre work. Does the map on infectious disease indicators track diseases in Canada only or globally for data exchange?
Sorry, what's the question again, please?
Does the map on infectious disease indicators track diseases in Canada only or globally for data exchange?
Whatever we presented, this is only in Canada. From Julian presentation, you see that some of the diseases may be out of Canada. They're coming to Canada, especially the dengue fever, which is not a concern yet for Canada, but many parts of the South Asian and Southeast Asian countries where these infectious diseases actually become wide because of the aviation industry. But whatever so far we presented here is basically from Canadian studies, the infectious diseases that we presented here. Yeah.
I would just add to that, the maps that we have on the atlas, we've created some maps related to infectious disease, such as the map showing the spread of Lyme disease into the future, the projected spread according to the climate variables. But most of the interactive map on the climate atlas has a range of about 30 different indicators that you can play with through time and different carbon scenarios. But those are mostly, those are all like climate specific indicators. So you can look at changes in precipitation or temperature and so on. But the connections to infectious disease have to be sort of deduced through those climate variables in other than the specific maps that we've made for specific diseases.
Great. There's a follow-up question from Elshima about there was a gender difference in the level of concern on climate. Did you observe an age difference from your survey?
Yeah, in terms of the level of climate concern, I believe there was an age difference, but not super significant. There were lots of different demographic differences though, and we've reported on a lot of them, a lot more than we were able to share in the presentation today in the paper that is forthcoming for publication. So maybe we can find a way to circulate that to participants when it's available. So yeah, I can't speak to the specific numbers, but there were definitely some interesting differences there.
That's great. We look forward to reading those publications. Okay, I'll pose this question to Jillian, who Krishna asked, who are some of the stakeholder organizations that made up your interview panel of key informants?
Yeah, I can't name the organization specifically because we did promise anonymity to all of our key informants so that they were able to share openly. However, I can kind of tell you, the types of organizations that we spoke to. So it's actually very hard to find individuals and organizations that are working at that specific intersection of climate change and infectious disease. So we reached out to kind of experts in infectious disease who have work that's kind of informed by the climate or in climate change, and then people working in climate change and health where they may be addressing specific issues related to infectious disease. Then we also went broader than that as well. We reached out to kind of different planning organizations, municipalities, places like that are dealing with these real-time effects of climate change and infectious disease. So, reaching out in areas where Lyme disease is more prevalent, for example, to get their perspectives on how they've been dealing with that. And then, so working with academic researchers as well. So, we've tried to really look at different universities, what they were doing. We also went through the Public Health Agency of Canada's list of funded projects for their infectious disease and climate change fund. That was a really great starting point for us to look at kind of who is working on these types of issues. And we went from there.
Excellent. Thank you. Oh, we have a few minutes left for some really great questions coming up. Also, here's a question that's not directed specifically at any of the speakers, but feel free to respond. From Scott, what have you and others learned about how temperature affects invasive mosquito populations related infectious diseases like West Nile virus, Zika, Eastern equine encephalitis? What have you learned about how precipitation also affect these things?
Yeah, I can jump in to start here. I mean, at the Canadian Public Health Association, we're not doing this research specifically, but we're trying to share the platform for those who are. So I'd encourage you to look at one of our previous webinars with the Windsor-Essex Health Unit, where it was really mosquito focused, and they are, because they're one of the most southern parts of Canada, they are seeing differences in the mosquito populations, and they're really doing a lot of great surveillance. So you can learn more about them there. But I also know the Prairie Climate Centre have a mosquito section on their website. So maybe Laura or Alam would like to elaborate further on that.
Yeah, similarly, we're not doing that research ourselves, but just sort of writing about it in a way to synthesize what's out there and doing a lot of expert interviews as well. So we do have a sort of like a plain language article summarizing some of the impacts, as well as a short video. It's about 3-4 minutes with experts talking about the spread of mosquito-borne diseases. and specifically West Nile virus as an example on the Climate Atlas. So those might be of use.
Yeah, I would just
Yes.
like to add, there are like many scientific research, many scientific papers already show that there is a link with infectious diseases and then the rising temperature. So many of the concern we see in many other parts of the world, still not like a concern in Canada, but like Western Nile virus, West Nile virus is already there, but many other viruses like the dengue fever, this could be pretty much common in Canada if the temperature is rising, because this is going to create more like conducive environments for those mosquitoes. So currently we don't understand or we don't have any much studies on that, but in the coming days, I'm pretty sure this will be in the research communities, that how this temperature is contributing to these mosquito related diseases. Yeah.
Thank you. There's a question from Praxchanda, which draws from the motivation of knowledge into action, and particularly at the personal level. How do we unpack how people understand climate change effects at a personal level? Because broadly speaking, climate change is affecting human health, and people understood that. But how would they actually incorporate that? Would your survey had led to any insights in that regard?
Well, we can see right here in Canada right now, it's happening in British Columbia. We can see this past summer is one of the worst heat waves in Canadian history. And many people had to evacuate because of the wildfires. So it's impacting at the very personal level. And this will be much common in the coming days if we don't address it right away. So the trauma, the mental stress that they had to endure during this wildfire, it's a huge impact on them, very personal level. And as I mentioned, that the gap, like how climate change is impacting people at personal level, there is a gap, and that's what we try to communicate here. Yeah.
Yes.
I would add to that, I think, in response to the open-ended question in our survey, we did have sort of those impacts that were shown in terms of the most common ones, like food security and air quality. And some of those, were more specific kind of examples that we then grouped into these sort of broader categories. So people talked, I think, at different scales about in their specific answers that were sort of grouped into these codes. But there were also, interestingly, some more indirect responses. A lot of people mentioned which groups they perceived to be most vulnerable to health impacts, or sort of like that health equity piece, which was interesting because the question was just like, how does climate change impact human health? And right away, a lot of, like, we had 235 responses that were specific to that vulnerability piece. And also a lot of people mentioned the economic impacts of climate change and sort of that, like, broadly that connection to their own like mental health or well-being or livelihoods and so on. And so there was sort of this like broader understanding. It's hard to, in an open-ended question, it's hard to know, was it like a broader understanding of the health impacts of climate change, or was it sort of people just putting in whatever impacts they wanted to talk about that impact their lives? And you don't always get the resolution that you want, but there was some interesting sort of interpretations there.
Right. And we all know that health encompasses psychosocial dimensions as well. So the mental health impact is enormous. And a little plug for NCCH webinar coming up in our own series is on sharing their findings from a CIHR funded study on psychosocial impacts of the pandemic together with climate change. So stay tuned for that for the new year. We have a minute left, and I want to pose this final question from the audience, although we are very limited to a very short answer from our speakers regarding the movement of malaria into Canada. How does climate affect that? And I think Jillian may want to point the audience back to the recording of the Windsor Essex webinar, correct?
Yeah. So I'm definitely not an expert in this, but from my understanding of our previous webinar that we had is that there's very specific types of mosquitoes that can transmit malaria that in the past we haven't had in Canada. Therefore, we haven't had the spread, like local spread of malaria in Canada. But as Canada warms, we can kind of become a place that can host these exotic mosquitoes that can transmit malaria. Therefore, there's more risk of that local transmission.
Right. Well, I feel like we could extend this conversation much longer. I didn't even get to ask my questions, so I may have to ask this offline, but I really do thank all our audience members for joining us today, for their active participation and posing these great questions. And of course, big thanks to our presenters for your wonderful presentations today, sharing research findings and thought-provoking information for us to take away. An additional final reminder, please fill out the survey upon closing this webinar window. Your feedback is very important to programming, so we appreciate you taking a few minutes to do that. And this does bring us to the close for the final webinar of the calendar year 2021. We hope that you'll be back to join us for more exciting presentations hosted by the CPHA in the coming year. We wish you all keeping well, staying safe, and a lovely holiday season coming up. So thank you and have a good afternoon. Take care. Bye-bye.